A dimensional diagram of a child's head is displayed. Visual pathways, or nerves, from the eyes to the optic chiasm and then to the occipital lobes at the back of the brain are highlighted.
Cortical visual impairment, or CVI as it's commonly called, is caused by damage to the visual areas at the back of the brain, called the occipital lobes, or to the pathways immediately leading to these areas.
A tiny baby lies inside an incubator at a hospital.
This damage can be the result of a variety of causes, but it's primarily caused by lack of oxygen at birth, malformation of the brain, head injury, or infection.
A diagram showing a cross-section of the eye is shown. Directly in front of the lens and pupil is a small human image representing the visual image entering the eye. The image is shown upside down on the retina at the back of the eye.
In normal vision, light is focused on the retina of the eye, which transforms it into complex electrical messages.
A diagram of a child's head is shown with visual pathways leading to the visual cortex highlighted.
These messages are transmitted by way of the visual pathways to the visual cortex, where the information is received and transferred to other areas of the brain for analysis.
Babies with normal vision are seen tracking objects.
We all know that a baby with normal vision shows a great deal of curiosity about everything he can see.
A toddler with CVI is seated on his mother's lap. He does not respond visually to a bright neon toy, about 4 to 6 inches in diameter, that is being moved horizontally about 6 to 12 inches from his face and eyes. A toddler girl with CVI is sitting in a high chair in her kitchen with a brightly colored bowl of balls on the tray. She appears to have low muscle tone and poor head control, and does not appear to see the bowl of balls. She slumps down into her chair as the clip fades.
When there's damage to the visual areas of the brain, the eyes may appear to be completely normal, but the child will have varying degrees of difficulty in processing and interpreting visual information. To an observer, it appears as if the child is simply not interested in using his vision.
An elementary school-aged boy with a visual impairment lies on an examination table with electrodes attached to his head and wires running from the electrodes to a machine at the right of the screen. The child watches displays of light and patterns on a TV while another monitor displays his brain activity. We see shots of black and white checkered screens and a computerized EEG that records his brain's responses to the visual images that he is seeing.
A VEP, a Visual Evoked Potential Map Study, can be useful in the diagnosis of CVI. This is a computerized electroencephalogram, which shows in color the degree of electrical activity of the brain in response to flashes of light or other visual stimuli. This child with CVI has reduced electrical activity over the visual cortex.
A toddler with CVI sits on her mother's lap and plays with a small yellow rubber dragon.
Fortunately, total cortical visual loss is very rare, as most children have some remaining vision, and there tends to be a gradual improvement during the early years.
Children with visual disabilities and motor impairments are shown in a wheelchair and with a walker. Both children appear to have cerebral palsy.
In many cases, the damage to the brain is not restricted to the visual areas. If there's also damage to the motor areas of the brain, the child will have an impairment in his motor development. For example, he may have difficulty learning to walk, to crawl, or even to sit.
Children with CVI are shown. A toddler looks at a book while seated in his mother's lap. An Hispanic infant is on his back on the floor with a portable A-frame with dangling toys over his chest. The infant bats at the toys with his right fist and appears to look at the toys using his peripheral vision. An Asian preschool boy with glasses and poor head and trunk control is seated in a wheelchair with a tray. His TVI tries to get him to visually attend to a large Elmo puppet in his right visual field. A toddler girl is seated in an adaptive chair with her hands fisted on the tray as a red mylar balloon in the shape of a heart is moved horizontally in front of her face. She appears to respond on a delayed basis.
One of the most characteristic and also most puzzling aspects of CVI is the variability in visual functioning. The ability to see can change from day to day, from hour to hour, and even from moment to moment. Fatigue, illness, discomfort, medication, all can change the level of alertness, and thus change the child's ability to process visual information. Some children have a consistent time of day when they are most visually aware and are able to take advantage of visual stimulation.
A preschool boy is positioned at an adaptive table in front of a stone fireplace. A brightly colored toy is presented to him without sound. He reaches for the toy eagerly, manipulates it with both hands, and takes it to his mouth. His movements are jerky. He appears to have cerebral palsy. An Asian preschooler with CVI is seated in a wheelchair staring at an overhead light rather than at the book that his TVI is showing him. The TVI turns the wheelchair around to interrupt the light gazing and redirects the child's attention to the book.
Many children with CVI enjoy staring at lights to a greater or lesser degree. This is probably because lights provide a very powerful source of visual input, and one which the child can easily analyze. Light gazing is generally harmless, unless the child stares at the sun, in which case he can damage his eyes. Sometimes children can be distracted by lights from attending to more meaningful activities, in which case the child's positioning should be changed to avoid this problem. Surprisingly, some children can appear overly sensitive to bright lights at times, and at other times engage in light gazing.
A preschool boy with a visual impairment is at the eye care specialist having his eyes examined.
It should also be noted that some children have a combined problem of cortical visual impairment and ocular visual impairment, which is damage to the eye. Whatever the case, careful assessment of the child's visual status is needed in order to fully define the problem and plan the appropriate intervention.